Hello, everybody, and welcome to Marvin's Fireside Chat, looking after each other. Today, we will be reflecting on connection, compassion, and hope. Just a simple note before we begin. Today's conversation includes discussions of suicide, suicide loss, and the mental health and well-being of healthcare professionals. Heidi and I know that these topics may feel very personal and close to home, so please give yourself permission to stay away, to step away at any time, and take whatever space that you might need. If you or somebody that you know is in immediate danger, please contact your local emergency or crisis service. In the US, you can call or text 988 for immediate support. And I want to move along, and as we begin this fireside chat today, thank you for joining us. I'm Jacinta Harmon, the Vice President of Clinical Services at Marvin Behavioral Health, and I'm also a licensed clinician in Pennsylvania. With me today is Dr. Heidi Schrumpf. Hey, Heidi. Please say hello, introduce yourself.
All right. Hello, my name is Dr. Heidi Schrumpf. I'm a licensed clinical psychologist, and I'm the Director of Clinical Services here at Marvin. It's great to be a part of this chat today with you, Jacinta.
Oh, thanks, Heidi. So each September, we're reminded of the importance of suicide prevention and of really just looking out for each other. And so today, as two clinicians, myself and yourself, we're going to reflect on the people that we've cared for, the experiences that we carry, and how they have shaped us in our personal and in our professional careers. Today is a chance to talk honestly about that and to remember that caring for ourselves and each other isn't separate from the work that we do. It really is a big part of the work. So let's start the conversation by talking about the patients or the events that we quietly carry with us, Heidi. You and I often talk about caring for the people that we have worked with, but we really not don't really so much talk about what the work asks of us as clinicians. Many of us experience the loss of a patient, a colleague, a loved one to suicide at some point in our careers, and that stays with us. If you're comfortable sharing, can you tell us what has stayed with you and what you have learned from carrying those experiences?
Absolutely. When I think about practicing in healthcare, I used to work for a very big hospital system, and I can't help but reflect at how a patient passing, whether it is natural causes or something medical or by suicide, these deaths all stay with us, and they're not something that we're necessarily practiced at coping with. So we don't we hear about it in theory in school, but we don't go much
Yeah.
beyond that. And what strikes me is the people that I carry with me are the people who it affected not just me, but a team. And thinking about a time I was working on a multidisciplinary team with cochlear implants, and we had a patient pass by suicide. And that feeling of that grief hitting you immediately, and then the panic of, did I do something wrong? Did I forget something? Did I not assess properly? What could we be doing differently? Oh my gosh. And just that combing through the chart looking for anything and second guessing yourself, and then having to reassure myself. I dotted my I's, I crossed my T's, I consulted, I did all of the things. And then also going to that team with the audiologist, the physical therapist, a neurologist, and talking about these are the things that happen, and this is how this can occur, and these are why we do some of those things, and reassuring them. And same thing as a leader in that system. Oftentimes, I was the first one to hear about a patient who had died by suicide, and having to go to my team member and let them know that the patient they had been treating had passed, and walking through that process with them and holding their hand, and how vulnerable we all feel when we go through that and feeling like, what is the right response? And there just isn't one. We could have dotted all of our I's, crossed all of our T's, and sometimes suicide just happens. Sometimes we can do things to prevent it. Sometimes it's impulsive. And then carrying that weight with us and changing how we practice or how we think about things. And sometimes that's a great way that we change. And sometimes it's just impacting us in that stressful, tense chest kind of way.
Yeah. I'm reminded of a nurse that I worked with for years, and we saw each other every day. We shared quick conversations. He was signing in, I was signing out. We'd meet in the chart room at the back of the nurse's station. And the last time I saw him, he smiled at me, said, this job is going to kill us. And I just laughed and told him we'd be grand. We had each other and we had these daily check-ins. And he died by suicide after his shift that night. And that loss changed me forever. For a long time, I replayed that conversation in my head, wondering what I'd missed, what I could have done differently, what should I have said, why was I in such a hurry? And eventually, I came to understand that suicide is deeply complex, and sometimes there are signs that we recognize, and other times there are not. In my head, this man had everything to live for. He had a child, he had a sick wife, he was going to have to take care of his daughter. And sometimes, even when we care deeply, we don't know what somebody else is carrying.
Yeah.
I'm curious, Heidi, from the story that you changed, sorry, not that you changed, from the story that you shared earlier about the way you practiced and after these experiences, did anything change for you in how you practice, or did it redirect anything for you in your
Yeah,
professional career?
absolutely.
Sorry.
Absolutely. I think when we have someone pass by suicide, it inherently changes the way that we think about things and the way that we go about things. And reflecting back on what changed for me, there was a lot. In the one specific example I gave with the cochlear implant patient, it changed an entire workflow. We went through and really reworked some workflows to make sure that every patient was screened for suicide, not just those who had depression, not just those who had had suicidal ideation marked, but every single patient that came through the department was screened. And personally, it really changed the way that I document, and I keep that in mind as I see anyone. I'm making sure I'm asking every time, even if it seems almost a little silly at times, like this person is not anywhere close to what we would assume or think suicide would look like or feel like or be like. But asking, I'd rather ask absolutely every time and feel a little silly or have them be a little frustrated with me, but then I can document very clearly. I also document very clearly what their positive supports are. So what are all the factors that lean towards they have great social supports, they have other things that lean away. So those protective factors so that when if something happens, I can go back not only reassure myself, but anybody else who might need some reassurance in that moment that we did everything that we could do.
Yeah, I think that kind of support is really invaluable because we do sometimes blame ourselves and second guess ourselves. And as I did replay those conversations over and over, I wanted to shift the conversation just a little bit to think about why it might be so hard when it's us. And what I mean by that is that we're trained to notice when someone is struggling. We hear the change in their voice, we notice that maybe our patient isn't themselves, and we really encourage them to reach out before things get worse. We're very proactive with the care of others. But when it's us as clinicians or as healthcare workers, I feel like the conversation is very different. We tell ourselves, oh, I'm just tired, or it's a busy week, or let me just get through this month and it'll be fine. And I feel like we normalize behavior in ourselves that we probably would be very concerned about if we heard the same thing coming from someone that we provide therapy to. Why do you think it's so
Yeah, I
much
agree.
harder? Yeah, go ahead.
It is. It is. It is so much harder to take care of ourselves. And I really think the reason that it's so much harder for us to take care of ourselves, our own mental health, even our own physical health, a lot of times, compared to one of our patients or our clients, really boils down to kind of two things. One is our training. We are always trained to look at the other person, assess the other person, look for what is the next step, what are the signs, the symptoms, the treatments, the that. Very little training goes into reversing that and paying attention to our own signs and symptoms. But that also plays into this is why we don't treat ourselves or we treat family members. We're too close to see it
Yeah.
sometimes. The other piece, though, is the coulda, wouldas, shouldas. The big ones is the shouldas. I laugh not because it's funny per se, but I hear it in myself and I can think of it in colleagues that have spanned the gamut of healthcare, those shoulds. We just should ourselves right into a little corner there with the I should be able to handle this. I shouldn't feel this way. I'm a trained professional. I should be able to cope with this on my own. I should know what to do next. I should be able to put
Yeah.
my patients first. My patients come first. And while there is some truth in that and even some glory or valor to that, if we are not taking care of ourselves, we aren't really putting our patients first because they aren't getting the best of us and they aren't getting the training that we got because our brain simply is going offline sometimes. It's being hijacked by the emotions or what have you. So I really do like to teach and get a little preachy. I'll admit that about that ethical care is taking care of yourself and it is checking in. It is consulting. It is those yearly, monthly, what have you appointments and taking time to recognize when we hear those shoulds coming out so that we don't box ourselves into this should corner and then we have something horrible happen, whether that is a mental health horrible or a physical horrible.
Yeah. I think that many of the people listening to this fireside chat today will recognize themselves in those wise words. Somewhere along the way, many of us learned that being competent meant being able to just handle anything. We just pretend on that if we're the ones providing the care, then we shouldn't be the ones needing it. But that's really an impossible standard that we set for ourselves. The truth of it is the work that we do affects us because we're human. It's not because we're weak or that, we can't manage or that we can't cope. It's that we're human and it takes its toll. I think that maybe the bravest thing really we can do isn't to just carry that weight alone. Maybe it's to just let someone know that we need some help and they can help us, carry it.
Yeah, I agree.
Was there ever a time that you can recall that somebody noticed that you weren't okay before you did, or maybe a moment when somebody simply asked, "Hey, how are you really?" And it just made a difference in that moment?
It's interesting that you use the phrasing that you did because, yes, there is absolutely some times when people checked in on me during times that I didn't really think that I needed it. I thought I was okay, or I was just kind of unaware. And it's interesting because the two that come to mind are kind of polar opposites. One is just this very casual thing that later I was like, now wait a dang minute. This is what he did. And the other one was a little bit more formal. So the first one, I was embedded in primary care as the kind of first touch psychologist for anyone coming through that department that may have had mental health concern. It was my first experience in medicine, feeling a little overwhelmed, and also really taking on some of that culture of medicine that I hadn't recognized previously. That
Yeah.
really is the we put ourselves last, this perfectionist piece of things. And I was very quickly taking on more than my job role described, not really knowing how to say no, becoming overwhelmed. I thought I was doing quite a good job of hiding it, but it turns out not so much. At the end of the day, one of who became one of my favorite primary care physicians in that department just kind of stopped by my office. The door was open. He said, Dr. Schrumpf, the only way you survive healthcare is you're either on vacation or you're planning your next one, but you got to take care of yourself. And I was just like, oh, yeah, I haven't, been on a vacation, blah, blah, blah. Had a whole back and forth with him about vacation. But that resonated with me. And later I was like, no, wait a second. He recognized I wasn't doing good and he stopped in and checked on me and had a whole conversation with me. And he's right. I've been doing one of the healthcare things where there's glory in not taking time off. And I had 500 hours of banked PTO at that point. I was like, that's not glory. That's not valor. That is me putting myself second. And I need to start using that so that I can cope better and have set better boundaries, do all those things. So that was great. And it just reminded me how kind of just quick and easy and those little check-ins, those little one-offs can do an amazing thing. And that next one was my boss. Very talented psychologist. She is someone that we all joke she can tell you to take long walk off a short pier and make you feel good about it. She's just that kind of person. But I wasn't doing great. And this goes back to the words that you used. It's very easy in healthcare where how are you doing? Oh, great, great, fine, fine.
Yeah.
We're all fine. But she changed the language there. She asked how I was doing. I did the great, great, fine, fine. She kind of laughed and was like, I don't know who you think you're talking to, but let's try this again. How are you actually doing? And it's like, oh, this wasn't a one-off, like passing, we're all doing great, we're all doing fine as we're drowning, but she actually had the time and she wanted to talk about it. And just that little language shift check that it shifted everything from the grapevine, let's keep it moving to she actually wants to hear it. And
Yeah.
then I was able to speak a little bit more freely. And she asked a couple, she didn't solve any problems for me. She just asked a couple questions that then got me thinking about what I needed to do next and why and what had contributed to it. So it was great. She just quick little check-in, triggered that whole scenario of, oh, I need to take care of this. Oh, this is the bigger fish I need to fry, and help me really get things back on a better path. So I appreciate both her and that primary care for both of their check-ins.
They uh they sound like remarkable human beings.
They were. They are.
So if we were to talk about what we've learned throughout our careers, I think that maybe you would agree with me on this, that the one thing this work has taught me is that there isn't a perfect checklist when it comes to people who are not doing well or who may have suicide on their mind. They don't always tell us that they're struggling. Sometimes they become quieter, they withdraw, they're more irritable, but then sometimes they're exactly the same as they've always been. And the truth is that really we can't know that someone is struggling unless they tell us. And that I think has to be one of the hardest realities to accept.
I agree. I think that that is one of the big tolls is it is extremely hard to accept that no matter how many times we ask what we do or what we say, we might not be able to prevent suicide. There are the times when we have our checklist that we go down and we ask every single right question, and we will, make the person feel comfortable, and they tell us the person is in the place to share that with us. We ask the question and they tell us. There are the times when we will go down that exact same checklist and the person will not tell us, either because they don't feel comfortable or even they've already made up their mind. And so there's kind of no going back at that point. And there's a whole other slew why someone may choose not to say something in that moment. Then the third piece is that sometimes it's impulsive.
Yeah,
And I'm thinking about a friend of mine's child had someone in their life die by suicide, and this person had no known mental health concerns. Life was amazing. Huge happy transitions were happening that this person was very excited about. And then a relationship issue occurred late at night. She was walking home alone, had the thought, acted on it immediately, and there was no turning back at
oh,
that
that's so
point.
sad. I'm
So
sorry.
yeah, there's no opportunity for someone to intervene or to ask. And even if someone had been right there with her as she was walking, there was no option, no opportunity for anything to happen there. So it's hard to sit with. And I know my friend and her child still struggle with the, well, I could have done this. I should have done this. What if I had done this?
Yeah.
What if I had done this? I'm like, you could have, would have, should have done all the things, and it may have resulted in the same thing because there was no sign or symptom or indication that anything was wrong. We can't always intervene or change things, and that's hard to sit with as a human,
Oh,
and
yeah.
it's extremely hard to sit with as someone in healthcare who is trained to intervene, trained to find the solution,
Yeah.
trained to find the fix.
It's so complicated. And I'm sitting here thinking to myself, I guess the goal isn't about becoming perfect at spotting early warning signs. Maybe it's more about creating those moments where people feel safe enough to say, you know what, I'm not okay. You mentioned, you touched on it earlier, but maybe it's checking with the colleague after a difficult case, or noticing when someone has gone quiet, or, just asking one more question, assuming that they're fine. Because a lot of times with suicide, I feel it's just knowing that someone cared enough to ask is where the conversation begins and gives people hope.
Yeah, it
So,
does. It does.
uh,
And I'm going to interrupt you for a second because it's something that you and I have talked about previously that just seems very fitting right here. We've talked about that there's this really great documentary that they did out of San Francisco. If you are familiar with San Francisco, the Golden Gate Bridge is there, and unfortunately, while it is a beautiful attraction, it has also become a targeted place for suicide. Um, but it goes through this guy's journey all the way through getting on the bus and going there and taking pictures of tourists and everything and just waiting to feel like he belonged or somebody cared or something mattered.
yeah.
And the second he jumped off that bridge, he said his immediate thought was regret. He regretted the decision. He wanted to undo the decision. And by some miracle, he lived. And this is what he teaches others now is that it is about creating those little human moments. It doesn't have to be perfect. It's just creating that moment, that touch point. You never know who you might influence or help.
I love that. Kevin Hines, I think, is the name of the documentary, and I saw him in person actually, and he was remarkable, so inspirational, and it gives me goosebumps just thinking about his documentary because, again, back to hope. You're right. All he wanted was to think that somebody cared, and so many people cared about him. So many people loved him, but somehow he got inside of his head that he was, more of a burden than he was a joy, and it is very heartwarming to see who he becomes after that. So yeah, he survived, which is just a remarkable thing. I want to talk a little bit about what people might do if they're worried about someone. And I know that this question has come up for me when I've done trainings with people. And one of the questions I hear most about suicide prevention is people say, well, what if I ask someone am I wrong? What if I, ask them how they're doing and I have completely misread the situation and they're not struggling at all? Or worse still, what if they say yes? Have thoughts on that?
Oh, I have lots of thoughts on that. As a clinician, it's like, yeah, I felt both sides of those when, like I said, when you asked how I changed my practice previously, I ask every person. And there's always that I'm kind of, okay, here it comes. I'm gonna ask, we'll see how they react. Because it's true. Sometimes people look at you like, now, why on earth would you ask me a thing like that? And sometimes people are offended by it. And sometimes it goes down the whole other path where they say yes. But when I'm quote unquote wrong,
Yeah.
worst case scenario, they're mad at me. I was wrong. They're mad at me. I can try to then use some different things to reconnect and repair that. But I would rather be wrong and know that I asked than wonder if I coulda, woulda, shoulda asked. So I do try to remind myself of that when that fear comes up. And that's what I tell other people I've mentored lots of young psychologists, pre-licensed psychologists, and when they bring that up, that is always the thing I say. It's worst case scenario is you're wrong, and then we will fix it on the back end, and it'll be fine. Now, on the flip side of that, what if they say yes? And that's a terrifying enough consideration as a trained therapist, trained psychologist. Now, when I worked in primary care, it was, I have 15 minutes, Heidi. I have 15 minutes. And what if they say yes? Then I have to do all of these things. Then I have to do all this. I'm like, yeah. And it's scary. And it's also because we know all the things that we have to do. We know that there are other people waiting. We also go through this thing of like, what if I forget? What if I forget all my training? I forget the questions. What if I don't do the thing? What if I document it wrong? What if the words come out of my mouth in a way that I don't mean them to, and I sound like I'm being judgmental or condescending or any of those things. And I like to remind people that those things might happen. we're all human. And if it happens, that's okay. And if it doesn't happen, great. You manage the situation with all of your training. You have hopefully a team behind you in some way, shape, or form, whether that is you have the pre-planned out, this is what I do in case of emergency, or you've got a triage team backing you that you can call. But we plan ahead for these things, and then we give ourselves a little grace that we are human. We might ask the wrong way. We might say something that, regardless of whether the patient says yes or no, or our coworker says yes or no, we risk offending them in any of those scenarios. But I would rather offend or not transverse things quite properly than, again, have those coulda, woulda, shouldas. What if
Yeah.
I had done this? What if I had asked when I didn't, or what have you? And then reminding ourselves we are trained clinicians, and that training does kick in, even in the most heightened fear states. It kicks back in, and we'll be okay.
Yeah. And, in the moment, the conversation doesn't have to be perfect.
Mhm.
Sometimes it's as simple as, you haven't seemed like yourself lately. Are you okay? Do you have a few minutes to talk? You don't have to have the answers. If you ask the question, I think that's the most important thing because that lets someone know that they've been seen and that they don't have to carry whatever they're carrying by themselves. And if they say yes, they trust you. And that is priceless.
Yeah. Yeah.
So,
And
uh,
even as we talked about with that documentary, even if they say no and the answer was really yes, you have now shown an indicator that you care, that someone was there, wanted to listen, and that can shape things on the back end too. So we never know what impact just these little things, the little how are you actually doing? You don't have to go through this alone instead of this is just how it is, you'll get used to it. But like, this is how it is, nobody gets used to it. And do you want to talk about it? Those little differences, even with the inflection or the facial tone, makes a huge difference.
so I think if there's one message that we'd hope that people would leave with today, it's that none of us is immune to
Mhm.
struggle. And not because we're clinicians and we're trained, not because we're experienced. It's because we care deeply. And we won't always see the signs, we won't always have the answers. Despite everything we do, as you said, we're going to experience loss. So I guess what I would say is to check in with each other, ask the hard questions with compassion, listen without feeling like you have to fix everything. I think that's super important. And try to remind people and remind yourself that asking for help is never a sign of weakness. It's a sign of being human. Any closing thoughts for today, Heidi, as we wrap this up?
I think you said most of them, and I agree. Just closing out with the reminder that we are all human.
Yeah.
And being in healthcare, we see the human condition from all angles. We experience it from all angles. We have to make sure we're taking care of ourselves and one another. A lot of time, our team, our coworkers, our colleagues, we spend more time with them than we do our own families, just given the nature of the beast that is healthcare. So if we can't take care of each other, we really need to take a step back and say, well, what can we be doing differently? Because we see each other day in, day out. We know each other like frontwards, backwards, sideways. We know each other's habits. We know when things are off. It's taking a moment to slow down and think about what's off for myself and have I reached out to somebody to either support myself or to support them. Just those little moments. Like I said, that primary care, all he said was to survive healthcare beyond vacation or be planning one. And that has stuck with me. It's been what, 30, 30 years, 25 years ago? I don't want to date myself too much. It's been a long time ago that he said that. So those little things, like you said, it doesn't have to be perfect, and we are all human.
Yeah. All right. Well, thank you for being part of this conversation with me today, Heidi. And I just want to say to the folks listening, if today's discussion has brought up any difficult feelings, please ask for help. Reach out to someone you trust. Your organization has support services, and there are mental health professionals that are available to help you work through whatever you might be struggling with. And if someone that you know is in immediate danger, as I mentioned earlier, please contact emergency or crisis services, and you can call or text 988 for immediate support. Thank you again for your time today, and we appreciate you listening. And Marvin Behavioral Health is here to help with your needs.